Hi, my name is B from Group 3, and our topic is supporting cochlear implants in children. Our resolution is that children who fit the criteria of benefiting from cochlear implants should go through with the surgery, and we are in support of implanting children with cochlear implants. Children receiving cochlear implants is supported by multiple factors, including developmental, social, age, and parental aspects. This is a diagram of a cochlear implant. They're not a one-time surgery, and they require updates throughout the years, as well as time, commitment, money, and flexibility. If a parent is able to do all of these things for kids, then that makes them a good person to be able to go through with the surgery, which allows us to have more research and studies for the future. One of the biggest factors in the fact that children should receive cochlear implants is their development. Deaf children are at higher risk of having behavioral and communication delays, being socially isolated and emotionally isolated, and having poor physical and mental health due to hearing loss. A lack of auditory input weakens communication between child and parent. This threatens many levels of development because our parents are our first experiences and children are sense-reliant. Observational studies by Lynn Coaster found that hearing mothers of deaf children are often controlling, directive, and intrusive in their parenting styles and become less patient with their children's behavior. In order to consider the children, we should also consider current-day civilians with hearing loss. Hearing loss is rated number 3 as the most problematic condition, and communication difficulties lead to social and emotional isolation. Dr. Anthony Hogan studied interactions between hearing loss and quality of life using the 2003 Australian Survey of Disability, Aging, and Carers. Of about 654,113 people with hearing loss, 71% experienced limited communication, 60% used hearing aids, and hearing disabilities at all levels was associated with poor physical and mental scores.
Cochlear implants have a social impact on the children who receive them by creating greater opportunities to fit into the society that we live in, especially when the child has parents who are part of the speaking community. Based on information from a journal called Cochlear Implants in Congenitally Deaf Children, a discussion built on rights-based arguments, cochlear implants are said to be helpful to the interaction of congenitally deaf children in social groups, and even to their eventual career choices, which broadens their opportunities. Furthermore, cochlear implants can enhance the recipient's safety in social settings by hearing sounds, and recipients become more aware of dangerous situations.
Deaf children must obtain cochlear implants at an early development stage to reach the maximum benefits of education, as well as hearing and oral communication. To reduce the effects of deafness in a child, the best age that shows the most beneficial outcomes is under 12 months old. It's very important that a child can learn through communication, making cochlear implants very important for deaf children. 12 months and younger may seem very young. However, it's crucial that the child is able to absorb the most information that they can during these early learning stages in life. A study done by Sharma Sunal shows that 75% of implanted children are now in mainstream education. Now, for parents who believe in sending their deaf child to a mainstream school, this is a great statistic. These percentages reveal that children who obtain cochlear implants younger have longer long-term benefits. Age, of course, is not the only deciding factor of how well a deaf child can obtain information and can communicate with hearing or other deaf children, but it definitely allows the child to grasp more tools at a young age.
From a parent's point of view, like stated before, deaf children have social delays in not being able to fit in with their peers. It also changes how they view and hear the world. Obviously, many parents don't want their children to go through more difficulties than they already have, and many of them don't want to be seen as different in school, work, and other occasions. This is why most parents opt for cochlear implants. In a recent study with about 33 parents, they all reported that the most stressful time was deciding whether or not their child should get the implant. Parents reported an outstanding improvement in their child's social skills, communication skills, and confidence after the implantation. On TikTok, there are a few families that show their support for cochlear implants. Here is a real-life example of the TikTok family Beth and Cooper. This is a hearing family with a deaf child, and with almost 1 million followers on TikTok, they show the positive looks on the cochlear implants.